A very warm welcome and good evening to everyone who is joining us on Facebook Live. My name is Singi, a member of the University of Malaya Medical Society COVID-19 Task Force, and also the co-host for tonight's tea session. Tonight, we will be speaking to our invited expert, Dr. Wong Chee Kuan, as well as our special guest, Dr. Bryan. You are most welcome to like, react, and share this live video out to your friends and family and get everyone on board to listen to first-hand experiences from our special guest. To all viewers, you are most welcome to join us on Slido by scanning the QR code provided, or simply type in slido.com in your browser and type in the code 208691 and submit your responses according to the survey that will be presented shortly. The session will start soon, so sit back, relax, and enjoy.
A very warm welcome and good evening to everyone who is joining us on Facebook Live. My name is Gerald, a member of the University of Malaya Medical Society COVID-19 Task Force, and also the co-host for tonight's tea session. It has been almost 2 months since the national COVID-19 immunization program kickstarted, and phase 1 is finally coming to its completion. While the nation gears up for phase 2 and phase 3, however, lately we have been greeted with many worrying news with regards to the pandemic and the vaccines. Malaysia is now heading into its new wave of infections, and the vaccine supply is still scarce. There have also been many worrying reports surrounding the adverse effects on the vaccines, which we hope to address today. Tonight, we will be speaking to Dr. Wong Chee Kuan, who is the head and consultant respiratory physician from the University of Malaya Medical Center and a medical lecturer at the Faculty of Medicine, University of Malaya. We will also be speaking to Dr. Bryan, who is a recent dental graduate from the Faculty of Dentistry, University of Malaya, and a patient who has recovered from COVID-19. Welcome, doctors. How are you all feeling today?
Hi, Gerald. Thank you for having me here. Yeah, I'm fine. How are you?
Good.
Yeah, hi, Gerald. Thank you for having me here as well. It's my pleasure as well.
All right. So before we start off the session, we have done a bit of a survey on Slido among our live viewers today to find out who they are and also what's their opinions with regards to the vaccine. So to all our viewers, if it's possible, you can go over to slido.com and type in the code 208691 208691 and answer the questions that's presented right now. Or you can also choose to scan the QR code to log in to the questions. Right, we'll wait. We'll give perhaps a few seconds as there's a bit of a delay between StreamYard and Facebook. So we'll wait for the response to start coming in. Okay, so as of now, majority of our viewers are among the age group of below 20 as well as between 21 to 40 years old. Okay, we'll move on to the next poll, which is we would like to know who our viewers are, whether they are from they are university students or they are healthcare workers or perhaps a member of the public. Right, majority, if all are currently university students. All right, moving on to the last and perhaps the most important question right now. Have they registered or have you registered or received your COVID-19 vaccination? We have gotten 8 responses. Majority of them have registered or received the vaccination. We have a small number who have not, this is quite encouraging. All right, so we'll move. Oh, sorry. I just realized I was not sharing the screen. All right, so perhaps the viewers just now did not get to see the QR code and the Slido as well. All right, so majority of them have registered and received the COVID-19 vaccination. All right, so now I'll pass it back to Xingyi to start off with the session. Over to you.
Thank you, Gerald. So once again, good evening and welcome everyone who is online on this T session, Should I Get the Vaccine? So we have here Dr. Wong and also Dr. Bryan. Yeah, it's our honor to have both of you here today. Okay, so let's start off our T session by discussing about the COVID-19 infection itself. Yeah, so as we all know, Dr. Bryan was a COVID-19 patient and he has recovered from it. So perhaps Dr. Bryan, could you share about your experience recovering from the infection? So when were you diagnosed of getting infected and how did you find out about that?
Oh, hi everybody, hi audience, and also doctors as well, and also the committees. About when were I diagnosed? Is it basically how did I find out? Is that there's this one day, which is the last day of 2020. I woke up like I felt a bit weird in a way. It's like then afterwards I went down and I had my breakfast. That time I feel that there's something wrong in terms of my smell, and I can't really smell the thing as strong as before. So I started to feel something weird is going on, and I proceed with my day as normal. But of course, I do practice all those SOPs and also take extra precautions because I might have some symptoms regarding about COVID-19 or something. That was that last time. And following a day, I mean, when the day goes on, the symptoms kind of becomes more and more obvious. I can't smell totally at around evening, around 5 to 6 o'clock. Before I go back to my home, I just straight tell my family members about it. Like, I felt something's wrong, and I straight quarantine myself, and I get myself swabbed on the next day, and the result came the following day. So yeah, that's like a very easy date to remember, last day and also the first day of 2021 that I got diagnosed as having COVID.
I see. So, do you know who did you get that from?
Honestly speaking, I don't. Yeah, I don't know where did I get it from.
Oh, so did they do any tracking? Like, do you know
Oh yeah,
something
they
about that?
do. They did some trackings according to my MySejahtera, and they asked me that time. KKM called me and they asked me to list out the places that I went to the last 14 days. So they want to do the contact tracing, and of course I did it out, and also I've also written down a list those that I think is under close contact. And of course, I do read all the guidelines from KKM as well, like what is considered as close contact. So I've written down a whole list and I emailed it to them when they wanted me to email to them that time.
I see. Okay. So where were you admitted that time, and how was your experience during the time you?
Oh, basically, how did I get admitted? That time after I got certified, like claimed as positive COVID patient, I was under home quarantine, and I don't really know what to do at that time, at moment of time, because there's no really one specific thing that I have to follow in terms of how home quarantine should be going, and should I wait for the call or should I call KKM for it? Of course, I don't really want to like disturb KKM people because that time is like the starting of the third wave, I guess. Yeah. So the healthcare workers are at its peak in terms of the there's not enough healthcare personnel to actually work in a way. They're kind of stressed out in a way. So I tried and find out what to do from my friends, from people around me, and actually I got admitted 5 days after I got the result of me getting positive COVID. So it's around 5th of January. Yeah. Then during that time when I'm at home, I just do some home quarantine, then use a specific toilet and quarantine as it is at that time.
I see. So while you were warded, how was your experience there?
Oh,
About the
sorry about that.
healthcare facilities or the healthcare workers? Yeah.
Oh, I was warded in HKL. I was in hospital KL, and the facilities there are actually quite good in a way comparatively to what I've heard about at the other quarantine centers or something. And for the experience over there, it's kind of a rather, of course, it's a first time experience as well, and it's kind of a rather different kind of experience in a way. Over there, most of the patients inside the ward that I'm in, most of them are healthcare workers. Healthcare worker means some of them are like medical assistants, some of them are doctors, some of them are dentists, and some of them are dental assistants, immigration departments people. Most of them are within these people. They call called frontliners in that say per se. So over there, basically, the experience there, I would say, is it's like me going into a place whereby I have to get to know some people over there because it's kind of a different environment at first. But of course, that few days over there, there are some people who are quite friendly in a way. That's why the experience of me in the hospital itself, I would say it's not as bad as you think.
Oh, okay. All right. So, aside from the symptoms, like you said just now, loss of smell, that's the start when you feel that there's something wrong. Did you feel any severe symptoms after that?
For me, I don't feel that I have any severe symptoms in a way, but let me think, on the second or third day after I was confirmed positive, I feel a little bit of sore throat, slight sore throat, but the sore throat is kind of different compared to normal sore throats. I can't really explain how is it, but all the symptoms are kind of very different and very kind of quite special compared to other normal symptoms that we have, like normal sore throats that we have. But the sore throat subsided one day afterwards. So yeah, that's about it. The severe symptoms in a way. Yeah,
I
that's the
see.
severest.
All right. Okay. Thank you for sharing your experience because like audience like me, we would like to know how the COVID-19 patient feels and what they have undergone during the time. Yeah. Thank you so much. Yep. So
No problem.
how about Dr. Wong? Yeah. So Dr. Wong is a respiratory physician. So perhaps Dr. Wong, could you share your experience while you are handling your first ever COVID-19 patient?
Yeah, Xingyi. Yeah, I mean, the first patients that was admitted to UMMC, I was not actually involved, but the first call I had was pretty bad. That was during after the tablet cluster, whereby a whole lot of patients who just come in with fever and breathlessness that you really don't know whether they are actually having COVID or just simple pneumonia. And patients were intubated right, left, and center. And it was a very, very busy emergency department. And the call was non-stop. And from 8 o'clock in the morning until the next day, I received call asking, is this patient a COVID patient? Which is the most difficult questions that during that point of time, because we have to decide who has to be tested, who has the highest possibility of there being COVID. And that night itself, there's one unfortunate Malay gentleman who was at his 60s, and he's actually working in a mosque as a cleaner. So he did not have any exposures to any patients with a positive COVID. All right. And he just landed in our emergency department in a severe respiratory distress, meaning that he's really, really breathless and he can't really sustain his oxygen support. And in that instance itself, the emergency department medical officer has to immediately intubate him and subsequently was referred to the intensive care unit and was admitted over there. So that was quite a horrible experience for each and everyone because patients landed in the emergency department without knowing what actually went wrong with him, and he can't really give you a history of what actually happened. He was too breathless to do so, and none of the family members knew what actually happened to him because no positive history of contact with COVID patients during that time. So that is something like a severe acute respiratory illness. That's we are doing the surveillance, and one of these is this patient. And unfortunately, this man was quite serious, and he actually has to stay in ICU for many, many days. I think more than 2 weeks. And once after he was recovered from the infection, he actually had a bad lung, meaning most of his lung were damaged, and we call it fibrosis or some sort of like scarring. Okay, and that kind of damage actually caused him to have a respiratory failure, and on top of that, he needed ventilatory support for a long period of time and succumbed to another infection, and he actually passed on due to that. That is a very sad story, and that the first patient I encountered, and is actually have quite a deep sort of like imprint in me, and then showing that how serious that this kind of like COVID patients can present to us. Yeah.
I see. So I believe that was a really hard time for every healthcare workers, especially during the start of the pandemic, and the virus is new to the whole world, right? Yeah. So okay. So Dr. Wong, based on your experience, how often are people presented with severe symptoms?
All right. Not just based on the experience, based on the what you call data that we have, right, worldwide. Yeah. Majority of the patients present with a mild or asymptomatic. Yeah. So about 20% of them actually can be asymptomatic, and so out of that 80% can be symptomatic, and they can be having a mild, moderate, or a severe form of conditions, right? So the mild and moderate roughly about 80%. So the severe one would be roughly about 15%. And the critical one, meaning those who actually come in shock with a renal failure, respiratory failure, those are the one roughly about 5%. Okay. So of course, during the initial clusters of the public, there's a lot of patients actually presented with severe form of conditions, which we were expecting, right? Because we look at worldwide, like the Italians, the Chinese, they have such experience, and we were actually constantly updating ourselves on how to manage all these patients. At the point of time, there were not much of like treatment options apart from supportive care, and everyone is like fighting for ventilators, and those who actually non-COVID patients who in respiratory failure was sort of like kind of neglected, because we have to actually take in all these COVID patients and manage them accordingly, right? So a lot of patients also ended up like in such a bad shape, right? So all these patients, whereby like 5% of them, okay, we managed to put them in the ICU, if not in the high dependency unit. But it is quite a difficult experience for everyone, including the ICU staff, the nursing, and also the one like constantly doing calls, managing all these patients. Yeah, there's about 5%. Yeah, of all those patients end up in our hospital. Yeah.
I see. So about the patients, those who have the severe symptoms, like their case is considered as very urgent, right?
Yeah. Yeah, in the respiratory failure. Yeah.
All right, I see. Okay. So, Dr. Wong, did you observe any like very heartbreaking moments that were experienced by the patients, the COVID-19 patients, when they were warded? Like some kind of stories which are very sad or which.
Yeah. Oh yes. Yeah. So we have a lot of elderlies who actually with a lot of multiple medical problems that some of them couldn't even take care of themselves, right? They are bedridden, some of them they need assistance, and this is the group of patients that will usually develop the severe form of COVID disease. And it's very heartbreaking that all these elderly patients are staying in a room, and we won't be able to have communications with them all the time. We only goes in and see those patients and manage them during the specific period of time, because we need to use our PPE wisely, right? Our PPE was also another issue during that point of time. We were lack of PPE. Everyone have to really be careful using it. When you go in, you have to do everything. You have to swab the patient, you have to manage the patients, you have to take the blood, etc. And so the communication with the patients are really little, really little, and they are very lonely inside, suffering with all those like symptoms, feeling breathless. And the sad part is they can't see their loved one. So their family members are forbidden to come to the ward because this is the important what you call infectious control measures. So none of the family members are allowed to have contact with that patient. And this kind of patient will usually end up in the severe respiratory failure, requiring ventilatory support. And sadly, I can say that they actually die in a very lonely way. So that's a very heartbreaking moment. I've seen many of them actually was alone in the room, okay, and it's difficult for the family members and also the patients themselves, right? There's no communications or little communications. In fact, the family members are unable to sort of like see them during the last moment of the patient. Yeah. So this is extremely heartbreaking.
Yeah, I totally agree. And yeah, so it's really sad. It's a really sad thing, and I think that's great to be shared, and as well as the experience shared by Dr. Bryan. Yeah, they can be as a lesson for us to learn, and yeah, we can avoid and we can follow the SOPs, yeah, to avoid ourselves from getting into it. Yeah. So thank you again for sharing the experiences. So maybe we can move on to the impact of COVID-19. Yeah. So I'm not sure whether our audience here have heard about this term called long COVID. So I personally not so sure about what actually it is, because there's a lot of sources out there, and we can't know the accuracy of the information. Yeah. So maybe Dr. Wong, could you help us to clarify what long COVID actually is?
This long COVID is something that happens after you recover from the acute infection. So it happens 4 weeks after the COVID infection, and it's linger up to 6 months, right? So the symptoms can actually start 4 weeks until 12 weeks, and 12 or way beyond 12 weeks up to 6 months. Okay, it depends on how long the COVID syndrome can happen. Okay, and it is involving multi-system. It can involve the mental status and also the physical status of that patient itself. So the common, what you call this long COVID syndrome, it actually happens in those musculoskeletal system, for instance, like feeling tired, fatigue, muscle weakness, and joint pains, right? So patients tend to have these kind of symptoms. And also for the lung, they actually can have feeling breathless, can have lung fibrosis, or we call lung damage or scarring. And they can even have some sort of like inflammation, persistent inflammation in the lung. And this can actually cause them to dependent on oxygen for a long period of time, right? And roughly about 44 to 60% of these patients actually having lung complications or secondary to the post-COVID, right? And also it can affect the heart. The heart can get myocarditis, and they can develop fibrosis of the heart and even autonomic dysfunction. So patients may have palpitations or even chest pain. Okay. So of course, the most people have heard of is like thromboembolism, meaning forming of a blood clot. So because this is hyperinflammatory condition. So the blood tends to clot much more easier, and it actually can clot anywhere in your body, including your brain, your lungs, okay, your any veins in over your legs, right? All these actually can happen. And some of those patients may have a neurological condition. They may actually have some neuropsychiatric problem, right? They feel depressed. Yeah, they can actually have anxiety, and sometimes they actually have problem with their sleep. Okay, some of them they have such a bad psychological distress until they develop a condition called post-traumatic stress disorder. I'm not sure, Bryan, have you any of this kind of symptoms, like, because some of those patients, when they actually, I've spoken a few of them when they were staying inside the room while they were on oxygen, and they just looking at the four walls and then without anything. So they feel anxious, they feel depressed, and they were every day they were thinking that which day they will go out, or either they die, or some sort of like that. They have this kind of experience, so it's very, very traumatic for them. So we have seen patients with post-traumatic stress disorder. Of course, there are other like conditions, such as it can affect the kidneys, and sometimes it actually can cause hair loss in certain patients. But it's not common. Like it's still a possibility that it can happen. So these are some of the conditions happening in patients with long COVID, and we have actually set up a clinic to look after all these post-COVID patients, and we're trying to detect all these possible long COVID syndrome and manage them accordingly, and sort of like refer them to the appropriate subspecialty to manage their conditions.
I see. Thank you for that clarification, Dr. Wong. Yeah, so we can see that a virus which is so tiny, it can cause so many different complications in different people. Yeah, so how about Dr. Bryan? Did you experience these long COVID symptoms?
For the long COVID symptom, like based on what Dr. Wong has said, I would say no. But previously, I perceived long COVID as in terms of like those lingering effects that that you could have. Like example, those cough or sore throats that brought over after a period of time after you have been discharged in a way, or like my smell that time is like slowly getting back. But yeah, now it's already, of course, it's normal already. But in terms of long COVID, that time I was perceiving it as like those normal coughs that I have, but it's kind of those like common coughs. So I wouldn't put it as what like I've already experienced long COVID. But at the moment, I don't feel any of the symptoms that Dr. Wong has said, other than probably some of the post-traumatic syndrome or something like that. But that one, I think I'm quite fine with that, because in the hospital that I'm warded in, we are allowed to go out of our room. So they are kind of like a small pantry, this kind of thing, and a lot of people are around there. They were like talking and chatting with each other. So in a way, it's not as kind of like there's only four walls and I'm just sitting there and then just thinking about all those stuff. So I think that actually affects as well in terms of what a person is thinking. Like if example there's only four walls surrounding you, you're definitely going to feel like slight anxiety in a way, and also you're going to feel lonely, and that slowly develops into different kind of symptoms later on, especially on towards mental issues. But yeah, for me, no long COVID experience at the moment.
I see. Thank you so much. So, aside from the clinical side of your the impact of it on you, let's look at another aspect of it. So, in your personal life, so did you face any stigma from the people around you, like friends or even relatives or anyone?
For the stigma wise, I would place COVID almost at the same level of stigma in terms of HIV at that moment of time. Especially right now. And right now it's much better because people are being supportive for those people who had already gone through all this, and they are, because it's not something that we want to get, of course. Like, people understand in a way, so people understand it better in a way. But previously, at that moment, it's like, oh, you have already infected with COVID. I don't want to, like, they'll be phasing out you slightly. Definitely, there will be that kind of stigma over that. And of course, after I'm already confirmed positive COVID-19 patient, there's definitely a lot of positive messages who came over, asking me whether I'm okay or not. Of course, these positive stuff are actually those kind of things that actually build up my mental capacity, build up my mental ability in terms of like how to cope with this virus at that time. But of course, with positive messages, there's definitely some negative messages as well. And we people usually focuses on the negative messages. Yeah, of course, at the moment, few times there are a few negative messages. Of course, those messages are those that impacted me mentally the most, in a way. Like, this type of thing slowly develops into, like, at that point of time, I'm like, in terms of mental preparation and all those, after I'm being discharged, I'm actually able to go out in a way and continue my work, continue my life and everything. But I have a feeling at that time, it's like, I'm afraid of people outside there. In terms of, I'm afraid of what other people are thinking about me. I'm afraid of the other people out there, and I'm afraid of people being afraid of me. It's a bit of catching like the terms, but at that moment it's like around 1 month or so, like 3 weeks or so. But afterwards, of course, life has to go on, and I have to overcome this problem. I couldn't let it stay within me, and of course I've overcome it. And yeah, these are the stigmas that I face. But all in all, I think right now people are growing to be more supportive, and people are growing to be, there's less stigma on towards them, because basically people don't want to get it, in a way. Yeah.
Yeah, understood. So I believe that is a really normal situation where a person will think like afraid of the how people think about me, you know.
Yeah,
Yeah,
exactly.
yeah. So thank you for sharing that. So rolling the ball to Dr. Wong. So did Dr. Wong observe any change mental health and also physical health of COVID-19 patients?
Yeah, I mean, mentally, I've seen some, particularly the staff, they were feeling very guilty. So because there are outbreak in the hospital, and they actually blaming themselves of causing the outbreak, which is not exactly. We should actually blame ourselves for that. It's just an infection. We caught it, and then it just happened. Because of that, the transmission was rampant in the ward, or in fact in the workplace, right? So of course, some of them, they were stigmatized, and during the initial phase, and they actually have a lot of depressive symptoms, and also anxiety. They wanted to come back and work, but unfortunately they don't feel the same anymore, because the colleague will actually have a bit of different view on them. And so these are the psychological aspect of this healthcare worker who actually developed the condition. In fact, when there were an outbreak happening in the hospital or in the ward, so I actually have to give them moral supports, and actually I yeah, virtually. It's obviously we have to do it virtually with a whole group of people, and yeah, that's the only way that can actually help them to feel better, rather than blaming them, saying that because they did not follow SOP and that's why the outbreak happens. There's always issue with the system. Okay, whatever it is the system. Is not the person. Okay, if anything happens in that particular area, it's because of the system. Okay, so we have to actually look at the system and improve the system, and therefore will prevent an outbreak. So now we have make it even better, and everyone is more vigilant when they are in the ward. So they follow the SOP. I'm sure the medical students you all know, right? So we are fully very strict about attending to the ward. I have to wear a proper PPE, and you must actually sort of like report yourself to the sister before coming in. So that's the uh, mental complications or psychological complications that happens in all these patients. Whereby for the physical one, because I'm a pulmonologist, I will be looking after all these patients with lung fibrosis or in fact persistent inflammation of the lung, and we have to actually assess them. Some of them will have to be on oxygen therapy, and we will have to rehabilitate them so that they can go back to their normal function. We have to make sure they actually go back to as normal as possible. So the follow-up will last for almost like 2 years, depending on how serious is the condition. So this is what we are seeing, and this is what we are trying to do for them.
Yeah, thank you, Dr. Wong. So we can see how big is the impact of this disease or this virus on people. Yeah, no matter on the patients or the healthcare workers themselves. Yeah. So how about the impact of this pandemic on our public healthcare delivery, meaning like the delivery of healthcare on non-COVID patients, Dr. Wong?
Yeah, obviously this is badly affected. When during the first cluster by the public, we actually have to close down our non-COVID services. We put it as minimum as possible. My respiratory ward became sort of like a half COVID ward. I mean, all those patients who we accept will have to suspect as COVID until proven otherwise. So, and a lot of our staff were deployed to manage the COVID situations, and all the non-COVID wards were closed down. The non-essential, not to say non-essential, not non-urgent cases, like for instance, the elective surgery are all slashed, no elective surgery, and no elective admission for any kind of like investigations. So everything seemed to be just stopped. The service stopped for a long period of time, roughly about 3 months. Then only you see there's a drop in the cases of the COVID, and we slowly reopen the non-COVID cases. So it actually has a lot of what you call effect to those non-COVID patients. They have the fear of coming to the hospital. They know that when they come to the hospital, they may actually catch an infection, because sometimes when you are put beside a patient, you do not know whether the patient also had a COVID infection that may transmit it to you. So like that's why patients are very afraid to come to the hospital, and they keep uh, their condition at home. They try to manage their condition at home until they are very sick, and until the point that they can't manage themselves, they'll land up in the emergency department in a very bad shape. So during that period of time, we are not just managing the the severe form of COVID patient, we're also managing those severe form of non-COVID conditions. They come in very bad shape. They can't get medications because it was a fully locked down MCO. None of them can come out. So some of them, they do not know where to get their medications, whether to buy the medications or come to the hospital to collect medicine. And actually, that's the reason why they ended up quite bad shape in the hospital. So I've seen a lot of TB patients. They actually waited until they become very, very bad, very breathless. Only they end up in the hospital and finally intubated. So these are the situations I was facing during that period of time. And of course, so the SOP were very strict. Okay, everyone has to be extremely careful. So then we actually have to cut down the clinic also. The clinic was only functioning at about 30% of a normal outpatient number. And of course, all this is just basically to make sure that we have adequate social distancing in the clinic, because the crowd in the clinic can actually cause an outbreak of a COVID. But I mean, slowly we actually revise the system, and patients actually can come over and manage their condition as outpatient, and they can collect their medications from the pharmacy. So we have a system to actually help them to do so. Some of those stable patients, we may call them up and actually postpone their appointment to a further date, so that they don't have to come into the hospital so often to collect medication or to see doctors. Some of those patients, we actually can delay their appointment. And we are trying to come up with telemedicine in future. Hopefully with telemedicine, there'll be a reduction of the number of visits to the hospital, and therefore reduces the risk of COVID transmissions to these kind of patients, which are very high risk of developing severe form of COVID disease.
Yeah, okay. So actually I can relate very well with what Dr. Wong said just now, because my own family members, they were talking about like they were worried to go to any healthcare facility because they might easily get infected, right? Yeah, and also the medications are now sent through delivery services. Yeah, so okay. So one last thing here. How has it been for the healthcare workers over the past year to fight against the pandemic?
Wow, this is a very difficult question. I think most of us are burnt out. There were one time that I was doing the course every 3 days, and actually I did not sleep very well. I actually lost about 10 kilos, I think. I think I lost a lot of weight. I was like walking around in the hospital, and the phone is just non-stop, and it was really the bad 3 months initially. Okay, so, and I was like busy opening the wards for COVID, and then close down the non-COVID wards and drafting guidelines, SOPs, together with the infectious disease unit. Okay, and we constantly trying to prevent an infection in the ward. Okay, so we also counsel people, and there's a lot of things. So we found that we as an administrative staff also feeling the burnout. So you can see how bad are the frontliners. Right? I don't really consider myself as a frontliner, no? Because although I have to see those patients, but I'm not the first one who actually attending to all these sick patients. The one who is attending to these people are the nurses, the doctors, the primary care doctors, or in fact the emergency department doctors, and of course the serious cases will be attended by the anesthetists and the ICU staff, right? This group of people, I really salute them because they have worked day and night trying to keep everyone safe and also make sure the patient is alive and well. And with their support, actually, the patient actually got better. This is a constant sacrificing their time and managing all these people. So they are kind of burnt out. They're feeling tired, and they're not much of a social sort of like a social event or socialize between each and everyone. Everyone just trying to finish their work and then go home and try not to socialize because the socializing can increase the risk of the outbreak or transmission among the workplace. So everyone just keep to themselves, and we only can do virtual meetings, and this is a kind of stressful for each and everyone, and we have a lot of uncertainties, so we don't know what will happen tomorrow, whether the number will go up or come down. We always look at the news, and we always see which day, if MCO, which is EMCO, etc., everything. So we are also confused, and we have to give the correct order to the frontliners. Otherwise, there will be a lot of damage. So it's a very difficult situation for each and everyone. So people may think that why the rules are changing constantly. It's not that we want to change it constantly. It's a dynamic condition and situation. No one actually have the control on all these things. So we have to adapt at that point of time on the best measure for that period of time. So that's the reason why it's keep on constantly changing. And you can see the documents have multiple versions from version 1 to version 10 or whatsoever. So it's constantly, it's a dynamic condition. So we weren't able to tell exactly to follow this for the long period of time. It has to depends on that period of time. What is the best?
Yeah. So that was a really difficult time for every healthcare workers, I believe. And yeah, I have heard about that the doctors, nurses, they said that most of their feelings are like they are having anxiety, they are stressful, and they also have the fear, towards this new disease. Yeah, and they also they are afraid of bringing back this infection to their family members. So this is also a part that contribute to their anxiety. Yeah. So thank you very much for.
I also want to add on that we have a few things when during the outbreak. So we always put some fruits like the oranges on the table, so that if we can smell the oranges, means that we are not infected. So that's something that we try to use to make us less anxious. And the other thing is we will take a bath before we go home. So we're trying to do all these things. So everyone is fighting for the bathroom. So these are how we look like during that period of time. Yeah. Just want to share.
Yeah. Thank you so much. Okay, so maybe we can move on to the last topic, which is on the COVID-19 vaccines. So Jared, would you want to take over this discussion?
Yeah, all right. Thank you so much, Simi. So, first of all, I apologize for just now in the beginning. I totally did not realize that I was not sharing the Slido. Just to give our speakers and everyone an overview of our viewers, the percentage of them, registering or receiving the COVID-19 vaccine. We can see like a majority of them have at least perhaps registered or received, but we still have quite a big number, 14%, who has not. So hopefully, with our current session, we can try to explain more and to let everyone get the right information. So to our viewers, if you have not joined onto our Slido, you can do it now. You can just scan the QR code and then go over to our Slido page where you can also submit your questions, which we will cover it in our Q&A session later. Or you can also go into slido.com and type in the numbers 208691. Okay, so just now we've been talking about two very heavy topics, COVID-19 infections and the impact of COVID on all different parts of the society. So this is to Dr. Wong. With the vaccines being rolled out in Malaysia, what does it signify for you and the other healthcare workers in the field? Hello, Dr. Wong, are you with us?
Right. Okay, so this is a very important way of controlling the disease. Yeah. So because the vaccinations can actually curb the spread of the disease, and that's the most important thing I felt, and also it will prevent our patients from developing a severe form of a COVID disease. And as you know, the long COVID syndrome is quite debilitating for the patients. Patients can go into respiratory failure, and that's something that we want to avoid. We have seen patients with such a bad lung fibrosis, and they actually have to end up with oxygen therapy, and some of them actually can't really make it, right? So if you see a lot of these patients, you will think that it's important to prevent the condition. If you felt that you wouldn't develop this kind of severe disease, you are wrong. Okay, everyone have the chance of developing such severe disease. I've seen young patients who is 40 years old who actually develop severe disease and have a long COVID syndrome and seeing me in the clinic. So we are trying to improve their lung function as much as possible, but whatever has been damaged, you can't really reverse it. So the COVID is one of the solutions to prevent a severe form of disease in any of us. All right. If you think you are very healthy, you can't get the disease, you're wrong. You can get the disease and you can transmit it to your loved one, especially those elderly. Okay, and you have not felt the sense of guilt. So those people had actually had those conditions and pass it on to their family members and loved ones. They actually felt very guilty. In fact, I have a friend who actually is her father had a COVID infection. He was not following his SOP, and then he actually brought the infection and passed it on to his wife. And his wife was having a severe form of COVID and has to end up in the ICU for 2 weeks. And you know how much it costs when that time they can actually manage the patient in the ICU in the private hospital. It costs like 10,000 per day. And only after that, the what you call ICU from the private hospital decided that the patient is too serious to be managed. Then they send her to the Sungai Buloh hospital. And it costs a lot for that patient, mentally, physically, and financially. And she also has some form of post-COVID condition. And the guilt will actually stays on with my friend's father, even though he actually recovered fully and without any sequelae, but the guilt will still stay with him forever. So these are the things that I felt if we can start to roll out the vaccination, and then if everyone actually decide to get themselves vaccinated, actually can prevent this disease and bring it down as low as possible, or become not severe enough to cause this kind of complications. Yeah, this is what I felt.
Yeah. So in a way, we can say that anyone has the chance of getting COVID-19 and the severe infection of it. Or if we don't get it, we might in fact transmit it to our loved ones. So getting the vaccines is sort of like putting a stop towards us passing it around the COVID-19 infection. So this is to Dr. Bryan. Right now, from what I understand, you are working in the dental field. So and you were also a recovered patient from COVID-19. So perhaps what are your views on the vaccine, and perhaps have you received your vaccine?
Currently I received it today morning. Yeah, my first dose today morning. Yeah, so I definitely have registered it, and they called me like a week ago, a few days ago actually, a few days back, about my appointment today. Yeah, so I just had my jab. Yeah.
So how are you feeling right now? Do you like, is it
Um,
sore or?
I'm feeling fine. Actually, the whole process isn't that there's like no pain at all for the process itself. Yeah, I'm basically currently just feeling. Of course, at that site, there's definitely some discomfort over there, but well, just don't touch it.
All right, I
Yeah.
see. So, before getting the vaccines, do you perhaps have like any concerns with regards to the vaccines? Because right now we have seen so many news about the vaccines, reports coming up from everywhere around the world, fake news.
Yeah.
Do you have any concerns?
Personally, I don't really have any concerns regarding about all the vaccines in the markets and everything, because from what I know and from what I've read, basically all the vaccines the same and serve the same function in a way. It prevents you from getting a severe disease, and that's what we really want in a way, because we don't want the people getting intubated or people getting severe or critical illnesses from the COVID to increase in a way. So it's basically creating that immunity in a way. And for me, basically my concern is, since I've already got COVID and I recovered from COVID, do I need to get a vaccine again? But turns out today since there's an appointment, so I just went over and I keep on asking the doctor. I'm a little bit skeptical at first, to be honest, but of course I read some online as well about like after 3 months you can definitely get your vaccines and everything. But I of course I still asked the doctors over there, and they did tell me after 3 months really, yes, you can take it. So I just proceeded with it and then just got my first jab. That's all. Yeah.
Right. Congratulations on finally getting your first jab. So,
Yeah.
about the topic of whether COVID-19 patients should receive vaccination also. Dr. Wong, could you perhaps tell us more? Because in Malaysia, we have 300,000, almost 400,000 cases, and majority of them did recover. So there are a very large number of them perhaps having the same concerns whether they should receive the vaccines even though they have recovered from COVID-19.
Yeah, they still should get their vaccination, because we can't tell whether the the antibodies that was produced after the COVID infection is good enough to prevent them from getting a second infection. So that's the reason why all those patients who actually recover from a COVID infection, they are actually recommended to vaccinate for COVID.
All right. Thank you so
Yeah.
much for the advice. So, Dr. Bryan, perhaps
Yes.
personally, like for you personally, your main concern was about, as a recovered patient, whether do you need the vaccination. But how about from the people around you? What sort of concerns or what sort of questions did you hear about from them with regards to the vaccine?
I guess most of us hear the same thing. It's basically a few things. one is the percentage efficacy. A few different kinds of vaccine. People are like prioritizing this one. This one is better, definitely better compared to the others, but basically it serves the same. And another thing is in terms of the thromboembolism, the blood clot or something like that. Of course, that's raising some issues. And also, of course, some of the vaccines out there saying that, oh, it's only like 50% efficacy in a way. So those are the things that I've heard, and those are the things that probably concern other people. And yeah, but basically vaccines are vaccines. Vaccines are for you to prevent you from getting that disease itself. Yeah.
All right. So now that you've brought up the very hot topics of the vaccine efficacies, the blood clot events. So moving into those topics, Dr. Wong, could you tell us what do these vaccine efficacies actually mean, and do they really matter? Because right now, although like what we see is Pfizer is 75%, Sinovac is somewhere between 50%, or depending on where the trial was done. But there were also numbers coming out saying there's a certain percentage it prevents you from severe disease, and also 100% it prevents you from death. Could you perhaps give our viewers an explanation, like what do all these numbers means, and whether it's which is the real important thing we need to take note of?
Okay, so according to WHO, 50% and above is considered efficacious as a vaccine, right, to prevent the disease. So all these vaccines whereby we actually going to receive are considered effective in either preventing the condition or preventing a severe form of like a disease. Okay, so it's more important to preventing a severe form of disease.
Yes.
Whether it will prevent you from getting infection, obviously some of the vaccine have better data, right? For instance, the Pfizer vaccine, which have most of us, the healthcare worker has actually received it. But it doesn't mean that the other vaccines are not effective. They actually are equally giving protection to the patients and also to the any health anyone, right? So it's important to get yourself vaccinated. So numbers are there depending on where the trials are done, all right? And also people were hearing that you still get infected despite of like after the second dose of vaccination. But what you need to know is the number is very small, and the most important thing is all these people, they do not develop severe form of disease. Okay, it's just a mild disease, and they recover quite quickly. All right, so it's important to get yourself vaccinated. Yeah.
Thank you so much for that advice. So to our viewers, to provide you some context, so there was this news that came out from KKM a few days ago, about there were 40 cases of our KKM staffs being infected, even though they have received both the doses of the vaccination.
Yeah.
But many people do not actually really understand that, the 40 cases, correct me if I'm wrong. So like the Pfizer dose, you require 2 weeks after the second dose, then only your immunity really sets in, right? And I believe the reason why we can't really blame, I think we can't blame the public for not really understanding the numbers, because like perhaps this is the first time the public is seeing numbers and they don't know how to compare like 40 cases, and people starts getting worried, 40, that's quite a lot.
Yeah.
We have vaccinated like I think 400,000 people,
Yes.
and out of them only 40. Yeah.
Yes.
So moving on, so like we've talked about vaccine efficacies, whether COVID patients should receive the vaccinations or not. Now the next very hot topic that has perhaps been going on for weeks is about the blood clot incidents about the vaccines, primarily involving the AstraZeneca vaccines. So the European Medical Agency has released sort of a notice. WHO has also released a notice saying that vaccines are the benefits outweigh the risk, but there were still many concerns about it. So, Dr. Wong, could you perhaps sort of let our viewers know about what this whole blood clot incident is really about?
Yeah, I mean, I'm not the best person to actually say this, but it is something that pick up from the surveillance of the after the patient is vaccinated, which is very good. So rest assured that when you are vaccinated, each and everything regarding the adverse events are documented, and they have the very good surveillance system. So that's why they pick up all these adverse events, including the thromboembolisms, and they are still unable to say that it's a very strong link, but there are instances happening in patients, especially female, with less than 60 years old, who are developing all these thromboembolic phenomenon after the vaccinations for this kind of like viral vector vaccines. Okay, so yeah, so but the thing is, he also have a very good efficacy in preventing COVID infection, right? So some of the time they need to look at the risk and the benefit of vaccinations. In some countries that cannot actually store vaccines of like less than 75 degrees Celsius, so maybe this is a better option. In Malaysia, fortunately, we can actually have a fridge that store the vaccines of less than 75 degrees Celsius. Not all the country has this luxury to do so. Yeah, so it depends on the country, the what you call their facilities and the availability. And if let's say the most available vaccine during that time is AstraZeneca, and it's protecting their population or community. Therefore, they may actually use that vaccines to for that purpose. So it depends on that situation itself. All right. So of course, if you have adverse event, whatever kind of like medication or treatment, you still have adverse event. But this kind of adverse event is pick up, and is we have a very good surveillance system for that. So definitely our country is also looking into this, whether we are going to use AstraZeneca vaccination is yet, I'm not so sure, but it's inside the program itself. It was stated is one of the vaccine that we will be using, but I'm not the best person to comment on this. But for me, I think the whatever vaccines is that are available for our country has gone through a lot of like technical evaluations by our National Pharmacy Regulatory Authority, and I have a very high confidence, a very high confidence on them. So I suppose they will actually look at the data carefully and decide whether they would use this kind of vaccine. Yeah. So it's the storage would not use as low as less than 75 degrees. So it's just 2 to 8 degrees Celsius. So it's quite easily stored for the cold chain, right? So it's not easy to store in certain country whereby they don't have this kind of like a fridge that can store a vaccine of less than 75 degree, like the Pfizer. Yeah.
Right. Thank you so much for that, Dr. Wong. So, in your opinion, how will the vaccine change the landscape of our pandemic? Will it be the prime solution that once we vaccinate everyone, then COVID will be long gone away from us? Or is that the case, or in a way it is not?
Yeah, I don't think it's the prime solution. It is one of the solution, right? So to tackle this condition is not just using vaccination. It's also the important thing is the ethics of each and everyone, whereby everyone should actually follow the masking, universal masking, right? Social distancing, and also hand hygiene. Of course, the most important thing is the universal masking, because we know that the transmission of the disease is via air droplets and and airborne, right? Depending on what kind of like procedure you are doing. If let's say the patient is intubated or on oxygen therapy, those are the aerosol generating procedures. This will cause airborne transmission, whereby if let's say the patient talk or sneeze or cough, those are air droplets. So it depends on, it's most important thing is masking. Yeah, so social distancing also another thing, and of course vaccinations is one of the solutions. It will actually help to reduce the cases, and therefore we can actually control the disease better. I don't think it will actually solve like disappear. It will stay together with us for a long time, as part of the condition that we have to manage for a long period of time.
Right. Thank you so much for that. So right now we'll move into our Q&A session. There are quite a lot of questions really for both our speakers, Dr. Wong and Dr. Bryan. So I'll just share the screen on Slido. So the first one, about the efficacy. I believe Dr. Wong did mention about the importance of the numbers and how how we should just take the vaccines when it's available. But I believe the different types of vaccines, the efficacies of each of them are freely available. But Dr. Wong, would you perhaps like to comment on this one?
Yeah, I mean, for the time being in Malaysia, we have two forms of vaccines, right? The Pfizer and also the Sinovac. Of course, the Pfizer vaccine, you have, after the second dose, you will have 95% of like efficacy. And whereby for the Sinovac, it depends on where was the study done, right? Okay, Gerald. So the study where in Brazil, it shows the efficacy of 50%, whereby places like in Indonesia, it shows the efficacy of more than 80%. So there are still a lot of data not published, so they are still waiting for those data to publish regarding the Sinovac. But Sinovac is considered a vaccines that have less side effect as compared to the Pfizer. Yeah. So and also it is considered effective because it's like protect more than 50%. Yeah. So the rest, I wouldn't want to comment first because so far we have not used them yet. These are the two vaccines is available, and most of our population will receive the Pfizer vaccines. Yeah, about 50% of them will actually receive Pfizer vaccines.
Right. Thank you, Dr. Wong. So the next question is for Dr. Bryan. With regards to your experience when you were warded in HKL, so just now you mentioned when you were warded that you were not restricted to your room, so you were allowed to go to a pantry or something like that. So could you tell us, when you were in HKL, did you receive any form of emotional support, whether formally from the hospital or like informally among those who were warded over there?
A very interesting question, but for emotional support part, I would say that most of the emotional support actually comes from the patients who are warded there. That building itself is the old Wanita and Kanak-Kanak building or something like that. So it's like a long hallway, and we are in our own room at that moment, and they're like a small gathering center in a way. So they were like talking about their sharing some of the stuffs over there in is like a way that makes the whole environment in there not to be too depressing in a way. It's like that's the emotional support I'm talking about, like in terms of that. But of course, emotional support in terms of the nurses over there, they do sometimes talk, although there's like limited staffs in a way, healthcare workers that comes by. In one day, I think there's only 3 times rounding. Yeah, 3 times rounding. The other times are more towards they'll be passing the food over, and other than that, the emotional support is from my family, friends, and other people around. Yeah.
Right, thank you so much. That was pretty interesting, because all along we have seen it on the news about other countries, like in the wards, the patients
Yeah.
are going around and trying to help each other. But it's also very nice to hear that in Malaysia, the patients are
Yeah.
also supporting each other.
Yeah.
So the next question, for Dr. Wong. So, how was your vaccination experience? I believe, Dr. Wong, you have received both your doses of the vaccine.
Yeah. Okay, so the first dose was uneventful. Um, I didn't feel anything at all for the first dose. I just felt a bit tired, and I just need to take the nap, and then after that, I was okay. But for the second dose, actually, I developed a bit of like swelling over my arm, and I had fever the next day. But it was just a short period of time. I just need to take some paracetamol and just rest for a while, and I was okay. So I still work on that day. No choice, I have to work. So, but it's not too bad. Yeah, it's not too bad for my experience.
Right. So to the next question, towards Dr. Bryan, I think the next two questions are quite related. So when you first diagnosed, were you worried of transmitting to your family members, or like what was the first thing that actually came to your mind?
Definitely, I'm shocked at first because basically I don't know where did I get it from, and I don't know who did I get it from, and I don't know basically when did I get it from. I mean, when did I get it? Because there's an incubation period as well. So in that sense, of course, I am worried about transmitting the virus towards my family as well as my friends as well as outside because of the incubation period. So that is the thing that I said, because although they are not like kind of like blaming me in a way, because they have to go and swab because they are considered close contact with me. Yeah, I mean, so they have to go to do their swab test, and they have to be quarantined for a few days because of me in a way. But that is why I said probably some of the factors in terms of mental issues that occur. But of course now it's much better. Of course, we wouldn't like to transmit to our family members, right? In a way. And for the first thing that came into my mind when I got positive is I was quite shocked at first, and the message came to me at around 9 o'clock at 2nd of January. I got my swab test done on New Year's Day. So it was kind of a shocking thing for me, but it is what it is. So I can't really deny the fact of it, and I do have the symptoms related to it. At first, I'm like trying to deny it. No, maybe you do it wrongly, but I do have the symptoms. So yeah, quite
Right.
shocking at first. Yeah.
Right. Thank you so much. So moving on to the next question. With regards to our current situation in Malaysia, so today our cases has hit another high. We have a new daily new cases of about 2,800. So Dr. Wong, how is the situation right now in the hospital? Since we are progressing into a new wave.
Yeah, so we are constantly ready for this because this is not the first time we are dealing with this wave. I mean, even the third wave, right? So we are well prepared. Okay, so we have a plan to sort of like manage all these patients. So we will have to open more wards for COVID patients, and we have to cut down the non-COVID admissions, and we have to deploy more staff to manage all these things, all these COVID patients. So we have proper documents and guidelines on how to manage all these people. So therefore, we are well prepared because it will not end until many of us are vaccinated, or it will not come down. The number will not come down, right? Or so it's very important to be vaccinated so that we can actually bring down the number. Yeah, so the situation now is getting worse. All right, we have more patients who's admitted to ICU, and in fact, as we are the tertiary hospital, we accept patients with severe disease, the category 3 and above. Those mild disease, some of them, they may be managed in the what you call quarantine centers, or they may be managed at home. It depends on whether they can actually monitor themselves at home or not. So we have all this system in place. Yeah, so we are concentrating on those severe form of disease, and we are trying to give the best quality care to them as much as possible. And also, we try not to overutilize our resources unnecessarily. So therefore, the what you call stable patients, the category 1 and 2, may be managed in other low risk center or at home.
Right. I think we are getting quite a few questions with regards to vaccine hesitancy and also AstraZeneca. But I think this one stands out in which says, although I'm a medical person, but I am still afraid of AstraZeneca because the complications is increasing. Dr. Wong, could you would you like to comment on this?
Yeah, I mean, as far as I mentioned, these are pick up, all these complications are picked up during the surveillance. So definitely all this will take into consideration whether we will use AstraZeneca as one of the vaccines. So of course, the government are quite transparent in this. So of like what are the vaccines will be used during this phase and all sort of like that. So at the moment, they are not using it yet, but I'm not so sure in future. If ever there are more data stating that this AstraZeneca vaccine is causing the blood clots, and they may actually decide to hold on that. So, but for the time being, we are using the Pfizer's and the Sinovac. Yep. So no news about the AstraZeneca yet. So I think everyone should wait and wait for the government decisions, right? So we can't actually comment too much on that. So, but for the time being, for those patients who is at high risk of developing severe COVID disease, they should be vaccinated. All right. So we are just urging everyone to register, because it's worse to develop a severe form of COVID disease. As what I told you, initially the patient will go into respiratory failure. They can get lung fibrosis. They will be dependent on oxygen for the rest of their life, and they may actually have to wait for a new lung to be transplanted. It's as bad as that. All right. So if not seen a case and you have not experienced one, so I'm sure you wouldn't want to, right? So this is the important message maybe you can pass on to them. So to developing a severe form of COVID disease can be quite debilitating. Maybe that can actually convince them to get vaccinated.
Right. So that we also have some questions which are not so much about the vaccines. So we have this question mentioning a few specialists like Dr. Lokman. Dr. Lokman was our previous Deputy Director General for Public Health, mentioned that our country should have finally gone for mitigation phase. So from your point of view, I suppose this question was directed to Dr. Wong. Should we?
Wow, this is a difficult question. I can I felt that mitigation phase. Yeah, I don't know. I don't really know how to answer this. Can I not comment on this? This is something. This is
Sure.
a
All
bit
right.
policy making. Yeah. Right.
Right. So I think we can end this with like our last question. So this is more about, I suppose, family support towards recovered patients who have developed the post-traumatic stress disorder. So is there anything that the family members can actually do to help
Yeah.
the recovered patients?
Yeah, I think they have to monitor their family members. When you notice that they are not sleeping well, they are having insomnia, they are finding it like difficult to cope, loss of concentration. These are signs of like they are getting some sort of like depression or even anxiety, and you actually should actually seek help for that kind of like symptoms. So in fact, in our post-COVID clinic, we have assessment on all these psychiatric or psychological manifestation. So we have questionnaires, and the patient usually they will answer all those questionnaire, and if we think that they have a psychological manifestation, we will actually refer them for counseling or in fact to see the psychiatrist for further evaluation. So it's important to monitor them if ever you notice that they are not right, they are having insomnia and anxious. Yeah.
All right. Thank you so much. So basically, that will conclude our Q&A session, and we're also coming to an end of our tea session for today. So before we wrap things up, perhaps can we have some final advice from both Dr. Bryan and Dr. Wong to our viewers out there? Perhaps we can start with Dr. Bryan.
Register for the vaccine. Yeah, I mean, basically there's not much. I mean, for me, since I'm a recovered COVID patient, it's just not to stigmatize them that much, because in a way, they've gone through a lot as well. Even being infected itself is already a huge news for them. It's already a huge thing that something dumped on them. So it's good to feel empathy towards them. And yeah, so register for your vaccines too.
Right. Thank you. Yeah, that was that I think that is really the most important message that we need to give it out there. Dr. Wong.
Yeah. Okay. So still again, please register for vaccination, and yeah. So also please do the necessary like universal masking, social distancing, and also hand hygiene for the time being, because these are the germs and will protect you from getting the infection. All right.
Thanks.
All right.
Okay.
Thank you so much to both the doctors.
Yeah. Thank you.
Thank you.
Yeah, thank you so much to Dr. Wong Chee Kuan and Dr. Bryan Hao for sharing your valuable experiences with us tonight on this tea session, Should I Get the Vaccine? So it is our greatest hope that more people will sign up for the vaccine, and at the same time, will fight the infodemic of false news surrounding the vaccine. We all should understand that it is our duty to take the vaccine to protect ourselves and also the people around us and the future of Malaysia.
Hopefully, with the rollout of the vaccines nationwide, this will perhaps be our first step towards returning to normalcy. If you have any comments for this session or you wish to see more similar sessions being organized, do fill up the simple feedback form that will be provided on the screen later or in the comment section on Facebook Live. Don't forget to register for your vaccines. This is the T session, Should I Get the Vaccine, with Dr. Wong and Dr. Bryan, brought to you by MEDSOC COVID-19 Task Force. Thank you everyone and good night.
Thank you.